Good afternoon, everybody, and welcome to Zahn Academy. Today we have Dennis Urban. Dennis is a CDT. He is also the Director of Operations and Clinical Education for Microdental and NADL's 2024 CDT of the Year. So we're so happy to have you with us today. Dennis, thank you so much.
Thank you, Fran. I appreciate it. And I'm really excited to share some of the information I'm going to be sharing today. And as you know, Fran, I pack everything in. I pack a lot of information into 1 hour. So
Definitely,
yeah, and
definitely.
it's not going to just be, what kind of material to use. It's going to be why are you using this and what the science is behind making these appliances and fabricating these appliances. So it's going to be pretty good. So looking forward to it.
Absolutely.
Yeah.
I mean, we're saying it's navigating 3D printed resins and being able to choose, but you really dive in deep and you give them a lot of information to make an educated decision on what is right for them as
Yes,
far as the workflows go. So thank you.
definitely.
And we look forward to your
Yeah,
presentation.
well, thank you, and thank you everybody for sharing your Wednesday with us here, and happy Wednesday, and hope you get a lot out of this. Thank you.
So you prepared some poll questions for us. I just want to let everybody know that this is definitely an interactive webinar. So if you wouldn't mind, I'm going to launch two of them now so that Dennis has an idea of who's in the audience and what the needs are, and he'll tailor his presentation to that. He's very good at doing that. So I'm going to go ahead and I'm going to launch one of the polls. So right now, we'd like to know if you are currently 3D printing in your laboratory. So if you wouldn't mind answering that question. Wow, they're piling in.
Mhm.
Thank you for being so interactive with us. So right now, Dennis, I can give you, they really came right in like gangbusters. So far, 43% said they are 3D printing in their
Nice.
laboratory, and 57%, I'm sorry, say
Mhm.
they are not.
Oh, okay, great.
In
Okay.
this poll, and we're going to do one other so we can get started. And this is kind of a three-part question, guys. It says, are you currently satisfied with your 3D printing workflow? So you could answer yes or no on all of these. And Dennis will let you know what the
Sure.
response is here. Here we go. And Dennis is going to tell us a little bit about what it's like being the CDT of the year. That's very exciting as well. And we
It's
want to
it's
keep
it's
letting
it's such
everybody
an honor.
know because that's like so
It's it's
amazing.
it's such an honor. After 46 years in the industry, to get this award uh and have my family there and to accept the award in Las Vegas is great. And I love this industry. I'm excited about it. I'm excited about the technology that we have, and yeah, this is great. This is like the icing on the cake for my career, which is great.
So now I just ended the poll. It seems that 60% are happy with their choice, and 40% are not.
Right.
40% are happy with the resin that they chose, and 60% are not. And as
Right.
far as the printer goes, 60% are happy with what they chose, and 40% are not. So there's an awful lot of
Yeah.
things that you could be, talking to them about. And
Good.
we
Glad
are
this
going
is
to be
taken.
doing Q&A at the end as well, guys. So
Great.
at the end, if you wouldn't mind just typing your questions into the Q&A box, Dennis will make a little bit of time at the end and answer some of your questions. So I'm going to turn this over to you. Thank you
Okay.
so much again, and enjoy, everybody.
Great. Thank you, Fran. And we're going to get started here because we have a lot of information here. So first, we're going to, let me see, make sure this is, here we go. So to introduce myself again, I've been in the business for about 45 years, going on 46. So I had the opportunity to travel around the world lecturing and learning since 1985. And that's when I really started getting my travel in and going to different countries, to different laboratories, and just loving the technology that's out there. And so this is me in Little Italy there. I'm big with wine and food, so I love going to restaurants and wine tasting. That's one of my hobbies here. But to top it off this year, I got the CDT of the Year award, which is great. And it's not just, I'm not bragging. I'm just showing you the passion I have for this industry. So it's great to be in the industry, and I'm excited about the times we're in with our technology. So I thought about the denture technology because I had a laboratory many years ago, and I had a denture lab, and I think it was from 1980 to 1995. And I always wondered how many dentures I made when I was in the laboratory. So I was doing an average of 15 per day, about 75 per week, maybe about 3,300 dentures a year. And it was all press pack and analog. And it was like 67,500 dentures for the time that I had my laboratory and a few years before that. And not one remake. No, only kidding. I'm only kidding. No, but the thing is, how many a number of brain cells killed by monomer? What was I talking about? The thing is that there are a lot of inhalation of monomer, and now we don't have to worry about that with 3D printed resins. So we've come a long way with new advancements on denture bases, denture teeth, bite splints, digital dentures, partial dentures, and surgical guides. And how many years did we not see any advancement on a removal side? We were like the stepchildren. We never saw that any new technology, and it's evolving so quickly now, and we have to keep up with it because things are changing for the better in the industry. So we're going to talk about 3D printed dentures, bite splints, printed models, some implant technology, material choices, communication, and of course, the ultimate goal is patient acceptance. So as you can see on the top left of the screen here, George Washington's dentures made of lead and whalebone. And then we have these old vulcanite dentures down on the right-hand side. And I remember seeing some of those when I started. But yeah, those are pretty nasty looking dentures here. So, but I understood they fit real well. But now we have highly aesthetic teeth and unsurpassed denture-based materials. And these are the dentures I'm used to producing. Look at the aesthetics and anatomy on the teeth and the acrylic. And it's just a beautiful looking denture, and it looks natural, and it doesn't look like a denture, and that's what I'm used to. So I had a little bit of resistance at first when I started seeing printed materials come out a few years back, because there's no way they look like this, and they were kind of bland looking, orangey. They attracted a lot of bacteria. There wasn't any flexural strength or high impact resistance, but we've come a long way. But now we can also match the existing gingiva on the patient. Look at that anatomy. That's just beautiful. We match the existing gingiva on not only with analog, but now with digital. And that's a whole other course. But I just like to mention that if you really want to get into just matching that patient gingiva exactly, we have the tools to do that. And we can mimic natural gingiva anatomy on wax try-ins and on printed try-ins. And I'm going to elaborate on some of the problems I had with that and how I overcame those in a little while. So this is my normal setup that goes out of a laboratory with an analog setup. And you can see the characterization wax up, and I try to make it look really good. So when we started doing printed try-ins, I said, man, how am I going to do this? And how am I going to get that look again? And did I get it 100%? No. But I'll tell you some of the funny stories in a little while when we get to talking about printed try-ins. But this is a setup, an analog setup with Vita teeth and different colored waxes to achieve the natural gingiva color of the patient. So, but now we can print accurate and aesthetic dentures with amazing fit, form, and function. We've really come a long way. So with that, since we're talking about removables here, this is a survey that was done a few years back from an ADL. And you can see that the percentage of full dentures that were highly aesthetic were about 29%, and standard was about 31% in this industry. This is about 2 or 3 years ago. And premium dentures were about 25%, and then the economy-based dentures were about 15%. That's changed a little bit in the last few years, but the percentage of full dentures was about 60% that laboratories provide. And if you look all the way to the right, look at the percentage of denture acrylic that is processed still with press pack, 55%. So there's still a lot of the analog way of processing and packing dentures is done by compression pack. And that's changed a little bit in the last few years. But as I go around the country and the labs who are just getting into digital or printed technology, they're utilizing a lot with the injection technique. But number one is still the compression pack technique. Isn't that something? So when we talk about digital dentures, this is about 3 years ago. It's about 8% of dentures in the country were digitally manufactured, and 92 were traditionally manufactured. We've increased that a little bit. I think it's probably up to 13, 14% now, and look at the partial dentures, which is about 18%. I love the technology with design, not only on full dentures, but partial dentures. It is so easy to design a partial denture and with either 3Shape or Exocad. So that's my choice when it comes to partial dentures. It really is. So and then with full denture arches that are implant supported, that are digitally done, is about 22% just a few years back, and partial denture cases was about 12%. So what about 3D printer use? You know, it was in 2019, it was about 41%, and it's up to 72% now in 2023. And this is one of the latest surveys that was done. And the largest amount of printing, an average in 2023, number one was crown and bridge models, and that was about 74%. Bite splints was about 51%. Denture bases and denture teeth was about 32, and RPDs was around 11. So it's pretty interesting. I like to look at these numbers. I like to see the changes over the years. Like I mentioned earlier, we're still evolving in this industry, but it's evolving in a good direction, which is great. So with that, I had to go historically. I had to look at the 3D printing history timeline here. I'm just going to run through this real quickly. It was pretty interesting what was considered digital and what's considered digital now. But 1971, digital dentistry, CT scans, computer-based analysis, right? I don't know if anybody was around back then, but I was. But anyway, to 1980, Charles Hull with stereolithography. And we started moving up to the 90s with cone beam tomography with digital dentistry. Then we went into AI. Believe it or not, AI has been around for a while, but it hasn't been perfected. They started using AI with implants, dentures, and case planning back then also. We just didn't hear about it that much. And as we go into 2024, now we have jet printed dentures, which are beautiful, printed bite splints, models, RPDs, surgical guides. So we've come a long way over the years with 3D printing. So where are we going in denture technology? Well, U.S. dental laboratories are seeing a dramatic increase in full denture cases, implant dentures, and partial dentures. You know, when I'm giving a lecture now, and I look around in the audience, and I go around the room and say, how many technicians here are crown and bridge technicians who want to get into dentures? And half the room raises their hands now. We say a lot of people want to get into denture technology now because it's a viable technology, not only for income, but for the growth of your laboratories and the growth of your careers. So there's more income opportunities for dentists, dental laboratories, and dental manufacturers. But with growing edentalism, we have to look at some of the problems what we had in the past. So right now it says, if this slide here says 36 million Americans don't have any teeth. It's up closer to 40 million. And 90% of denture patients are unhappy with the fit of their dentures. And that's pretty interesting. And, you know, over the years, I try to come up with a plan for our accounts in our laboratory. I try to partner with our doctors who are kind of apprehensive in doing denture work. And I'll show you some of the planning strategy that I use with our doctors in a minute. But some of the challenges for the clinicians was, you know, difficult to provide a good fitting denture. A lot of chair time, a lot of fitting, long turnaround time, 5 to 7 appointments sometimes for a denture. You know, sore spots, occlusal problems. So there's a lot of problems out there that a lot of these clinicians have. And now I'm finding more and more with digital technology, we're getting those clinicians in their comfort zone to do removables, whereas they were apprehensive and a little shell-shocked before about having to do removables. With problems with full dentures, like I mentioned, compromised stability, poor neuromuscular coordination on inclusion, and a low tolerance for mucosal tissue with sore spots on an acrylic basis. And patients' desire to have more stable and comfort denture. And the comfort level of the dentist compromised due to the excessive chair time. So that's still a problem out there. And we want to get doctors in that comfort zone. We want you to partner with your doctors and get them in that comfort zone with the predictability of digital dentures. So these goals for the final outcome, we want to create natural aesthetics, enhance facial appearance, compensate for that lost soft tissue in the correct way with accuracy, enhance that function with the right occlusal scheme, which I love those virtual articulators with 3Shape and Exocad. But we want to also create a denture with longevity, impact resistance, and bacteria resistance. And we have that now with these materials that are out here on the market. And that those elimination and the reduction of those adjustments on occlusion and sore spots in the dental office means so much for the dentist because of chair time and the loss of money. And now they don't have to worry about that as much. It's more predictable with less adjustments with digital technology. So patient expectations. So when I get together with our accounts here and we talk about full dentures or full implant dentures, we talk about how to speak to the patient and get the patient prepared. And we talk about the dentist should meet the mind of the patient before he or she meets the mouth. And what do I mean by that? Let's start asking questions. Let's have a patient preclinical interview for new patients. Ask them, what are your specific concerns or limitations? How long have you been a denturist? How many dentures have you had since your tooth loss? How did you lose your teeth? When was the last time your dentures were relined? And have you ever considered implants? So these are a lot of viable questions that we need to get answers before we start our cases. And then we have our checklist. Look at the patient complaints, the history of edentalism, tissue support, stability, retention. Look at the floor of the mouth and the tongue room for the position of that lower denture. A lot of people, when I go around the country giving lectures and doing hands-on courses, a lot of dental technicians and dentists don't take this into consideration, especially on a lower denture when they need more room because of the tongue and the floor of the mouth. Look at border extensions, centrifugation, VDO, phonetics, very important with phonetics, the way the teeth are set, occlusion and opposing dentition. So all this has to be taken into consideration. And we make notes on every one of these points here, and we take it back to the laboratory. This way, when we're manufacturing, fabricating our denture, we know what to look for and how to do this. And that with digital photography and sometimes video, with the video clips also with patients going into different excursions, especially with troublesome bites, that helps us create a nice, predictable, aesthetic, and functional denture. So we look at the remake factors. Number one is still the inadequate impression or scan. Number two is occlusal registration. 3, poor shade communication. And 4, the wrong choice of material. And this is what I want to try to get across today. Let's choose the right material for the right case. So I'm used to setting denture teeth that are really aesthetic and anatomical, good morphology. I want to use teeth that would unsurpassed dynamics of light, multifaceted, good texture, so it looks natural. And I want this to happen even when I'm making a digital denture. And we're going to talk about that a little more in depth in a few minutes here. But it's important for me to have a good looking tooth in a denture. I remember about 4 or 5 years ago, I was at a dental show and somebody showed me a printed denture, and the teeth were just horrible. The denture base didn't look good. And I said, I'm not really liking this, what I'm seeing here, and I'm not used to producing a denture. And the person who showed it to me said, no, the patient's not going to know the difference. I felt like saying, what dentist and what patient are you dealing with? Because let me tell you, the patients that we deal with notice everything, and they notice the difference. So why not give them the best that we can in technology and material? So let's look at a tooth that's going to have shape, shade, and light. The magic triangle, I call it, right? Aesthetic, prosthetics, shape, shade, and light. And that's what I try to achieve. And that's what I had. And that's what I was getting with my analog cases. And I'm very skeptical when doing a digital printed denture. But now we're getting a lot of these results with printed technology on denture teeth. When we talk about denture bases, what are we looking for? Because we want a natural look. We didn't get that years ago with the printed denture base. Low shrinkage factor, a variety of gingival shades, great bond to denture teeth, which we're getting now. Something that's going to be impact resistant, but we need flexural strength and impact resistance together. Otherwise, we'll have a brittle denture that's going to break and it's not going to be functional. Good finishing and polishing properties. And if you do everything correctly, when you're designing your denture, really don't have to do much finishing and very little polishing. And of course, color and fit stability is very important. So when we look at the considerations with traditional printed and milled, all of these come into consideration: high impact resistance, flexural strength, and natural looking shades. And one of the things that I was apprehensive with in the onset when I first started looking at on the digital side of denture technology was the bond between the denture tooth and the base. And there wasn't a great bond back then. But now we have such a great bond between the denture base and denture teeth, the right materials. It's almost fused together. They really work out well. And so that technology, we've overcome that negative technology that we've had years ago. So these are some of the dentures I made on the analog side. This is with Diamond D acrylic, which is a great acrylic, and it's nice to have that on the printed side. And now we have these shades with printed materials, which is great. But things can get confusing, right? And you go to a dental show, you'll see 25 booths with different printed materials and different printers. How do you choose, right? So you have to choose something that's going to be best for you and your workflow. If you want something, a higher end product, you're going to use higher end material, and I have 4 materials that I choose as my go-to as far as printed materials. I'm going to talk about that in a minute. So what material do I use? Okay, so there's so many different materials. You use Trusana, key print, Dentsply, or Flexera, or one of the many other numerous materials out on the market. And how do we do our research? Well, do your research by looking at what I just showed you. Something that's going to have longevity, fit, have the science behind successful cases, and that's what I look for. But we have to move in the right direction with digital and analog. And when it comes to design, I talk to a lot of designers about designing, and I want them to know the science behind what they're doing, and to have that science behind what they're doing, they have to know the analog way. So we apply analog and digital, and we combine it together to go in the right direction for a successful case. So when you talk about digital and analog, we still need to utilize the same fundamental prosthodontic processes to make a digital denture as we always have. And the clinician still needs to communicate and provide the technician with the necessary information for a functional case. And digital denture technology is still evolving, like I mentioned. We've come a long way, but it's improving at a rapid pace. And basic knowledge of prosthodontic principles, including providing accurate impressions, is even more important in the digital world because many details now we can see on a large screen, which could not otherwise be detected, which is great. And dentists still need to understand the importance of capturing accurate maxillomandibular records, vertical dimension, and centric relation. And technicians still need to analyze ridge relationships and then select appropriate anterior and posterior teeth for the desired occlusal scheme. I know we have libraries out there that the software kind of picks for us as far as the mold and shape, but sometimes I find that it's not 100% accurate. So we really have to look at that, the ridge relationships and those anterior and posterior teeth for the right solution for the patient. Well, now with 3D technology, it's possible to integrate additive manufacturing with the wider laboratory ecosystem. It's great. And we have new systems and solutions that deliver accurate and repeatable and cost-effective production in a laboratory. We can utilize a wider range of photopolymers now with different shades and different choices for the success and catering to the patient's needs. So what do we use 3D technology for? Trays, custom trays, models, orthodontic, prosthodontic, crown and bridge, digital models, surgical guides, dentures, orthodontic splints, crown and bridge. It's great. There's so much being utilized now with 3D printed technology. And now we have enhanced speed with precision, efficiency, and the prices are coming down a little bit with these materials. So my choice for printed dentures, I'll tell you my choice right now. So Dentsply, Trusana, and Flexera are my 3 top choices for these. They've been predictable. They've come through with the quality and the science for a successful denture. So Dentsply probably was the first material I used as for a printed denture, and I started out using the carded IPN teeth for digital technology for printed dentures. It worked out great, but now there's some great materials out there that Lucitone Print has. And so that's what we're using that now. We're using that for printed teeth. But I wanted to show these pictures here. Now I'm showing a denture that I've traditionally done on the left-hand side and on the lower, on the bottom. And you can see, these are the teeth that I'm used to using, right? Are we there with digital printed technology yet to match these denture teeth? We're getting close. I'm being honest with you. I'll be criticized for saying this. Are we there yet? We're almost there, but we're not 100% there. But they still look nice and aesthetic. Different materials have different aesthetic values. We have some translucency now. We have different levels of gradient translucency. It looks a lot more natural. The wear factor is great. So we've come a long way with that technology. So on the left-hand side, you'll see this is a Vita carded denture tooth here. So these are made one by one by hand in Germany. So they're beautiful teeth. And this is the Lucitone printed denture. It's a beautiful denture. A little bit different anatomy with the teeth, but if you hold this up to the light, you can see that reflection. We are getting the gradient and the different translucency with these types of dentures too. So the denture base and the IPN tooth resin has come a long way. It's a great product. It has consistency. They have something called a BAM factor, body activated material, which is amazing because there's another material that does this also with the when it's inserted in the mouth and the warmth in the mouth, the actual material gets stronger. They call it body activated material. So it's pretty cool. The studies they've done on this type of material. And for an economy type denture, they have a Lucitone digital value material, which is great. It's less money, and it's it's a value material maybe for an economy type denture or a temporary type of denture. And then there's Trusana. Trusana's been around for a few years now. They've come a long way with the technology. Trusana's tooth resin is 57% stronger when wet. Isn't that something? It's so that's important. That's amazing when it's in the mouth, what the saliva and that environment does to the material. It's actually stronger. And the resin impact strength is 10 times higher than the ISO standard. And that's important also. So you got the high impact resistance and that flexural strength also. Like I mentioned, the tooth resin is 2 times more resistant than PMMA. So this is a great factor because a lot of times what we're doing with PMMA, we're milling PMMA even for temporaries, and now we can print these types of temporaries with this material. We'll talk about temporaries in a few minutes, and we actually utilize some of this material for printing our temporary crowns. It works out very, very well. And then there's desktop health with Flexera. Flexera is really a nice material also. And that flexural strength is about 72.7 megapascals, and their water absorption is one of the lowest, which is great. You want that lower water absorption on these types of materials. But what I like is a newer material, the Flexera Base Ultra. It has 50% more flexural strength than the original Flexera Base. And what does that mean? You can make this a little bit thinner, so that 2.5 millimeter wall thickness is acceptable, and about 1 millimeter on the socket thickness. And it's a nano ceramic hybrid composite material, which means it's strong, it's accurate, and it's functional for the patient. So really good materials here. So taking all this into consideration, we also have the availability of such great software design features with Exocad and 3Shape. The software allows for complete control to change the shape of the denture teeth, and it's important to be able to create that ideal occlusal contact, especially for single arches against natural teeth. I have a little short video here just to show about what we can do with these design options here. You can bring those teeth into occlusion. You can widen the occlusal surface of these teeth. Check your working and balancing on the virtual articulator, and then you can actually print your full arch or quadrant arches, whatever you're used to doing when you're printing your denture teeth. So we mentioned before about a printed try-in. So I showed you my previous try-ins with my analog way, and that's what I was used to doing. So when the dentist that did work for us started seeing printed try-ins, they kind of flipped out on me. They said, "Oh my God, I don't want this patient to see this white monolithic looking try-in." And I said, "Okay, let's see what we can do with this." I even had doctors trying to stick hot spatulas in printed try-ins and try to move teeth, because they were so used to making adjustments. But now we can make adjustments on these printed try-ins also just by taking a Sharpie. If the midline is a little bit off, you can mark it on the Sharpie. They can grind down some of the teeth and taking a new occlusal record. We can rescan that and put it into the original file and do another printed try-in or print the final denture. So I like to utilize Keep denture try-in material. Comes in 3 different shades, and I'll characterize this also. So and even with our all-on 4, all-on 6 type of temporary or diagnostic dentures, we utilize this material also. It really works well. So again, this was my original try-in for analog. Am I going to get that on the final try-in? I'm going to try with the printed. I can come pretty close if I spend a lot of time. And how can we make a printed try-in look more natural? Well, a couple of different ways. Sure, we can use denture-based stain. It's going to take a lot of time. It's going to cost more, and it's only a try-in. It's only a try-in, but we want to make it look sort of natural. So what I'll do is when I'm designing a full denture, I can put my stippling in there. I can put my nice cuspid eminence and carvings, And when I print that try-in out, all I have to do is take a molten wax like this, aesthetic colored wax, and go over that printed try-in and melt it onto the try-in, and we can have a nice natural looking try-in. And so that's how I overcame those objections with these types of printed try-ins. And not only that, it's a great diagnostic tool for the patient. So many doctors are sending the patient home with these printed try-ins to just feel overnight to see how it feels, go into different excursions, maybe eat something and try to feel what that final denture is going to feel like. And they can give the dentist a lot of information when they come back about if it's positive or negative. If it's negative, we can make adjustments. That's what's so great about printed denture technology. So I use this aesthetic colored wax to different waxes. There's a lot of different waxes out on the market, to use, and that really works well when I want an aesthetic looking printed try. So we also want to check occlusion, phonetics, and make sure the aesthetics are pleasing to the patient. Okay, so now we're going to jump into another section here. Let me see how my time is doing. Okay, we're in good time. So what I love about digital technology also is with immediate dentures, with printed denture technology. So a majority of our dentures now are being done, immediate dentures are being made. And I have a whole course that I do. It's a 2-hour course on immediate dentures. And it's not just cutting teeth off a model and throwing teeth into wax and processing an analog, or doing the same thing when you're designing digitally. We really want to take some precautions and planning the right way when we talk about immediate dentures. And this is pretty traumatic for the patient. Picture a patient who already has teeth in their mouth, who may not be too healthy. The teeth might not be too healthy, but they still have teeth in their mouth. They're going to go from all to nothing, and we have to make them feel comfortable. So what do? We get together with our doctors. They want to advise the patient that the dentist in the lab are going to do everything they can to give them a natural looking functional denture. And immediate dentures can't always be tried in, and discrepancies can happen. But that's okay, because once the natural teeth are out of the way and the bites and occlusion are stable, then we can really look at the more precise denture work. Communication is key when we're talking about not only full dentures with these types of immediate dentures. Doctors should explain on a lab script that the patient wishes to replicate tooth positioning that exists, or if the patient a new position is required. So that's really important. Explain to us what we need in the laboratory, the tooth size and shape, and we can do this on digital technology. I'm going to show you the overlay functions that we have with designing these types of cases. So really important. We don't have to do a complete reset when a tooth needs to be added or removed. Also, with removing molars and premolars is as easy as a click of a mouse. Click on that. We want to remove that, we can remove it. So I love this software and the design software with doing immediate dentures also. And when we extract teeth, we should call it model surgery. Sit in front of our bench and start grinding teeth and doing tissue contouring. And it took a lot of time, a lot of dust. Now all I need is a scan from a doctor, and I can show this on the screen here. I highlight the tooth, I eliminate the tooth, extract it, and there we do some tissue contouring on the right-hand side, and we're ready to set our denture teeth and do our immediate denture, which is great. It's fun stuff. It's a lot of fun doing this. So now the pre-prep scan, like I mentioned earlier, if a patient wants to, really replicate the existing dentition or the position of them, we can do that with the pre-prep scan, because we can have an overlay function we can utilize. So say this is going to be an immediate denture. So we want to do an overlay function here, overlay that, adjust the occlusion, and then we can print our final denture, our immediate denture. So a lot of good stuff to do when, a lot of choices that we have when we're making these immediate dentures, even with, surgical templates. I'm using right now that we're using the key splint hard clear material for that, and it seems to be working out great. So we want to have the accurate adaptation of an immediate denture for the patient. So we want to have a clear surgical template, and we have to do realistic contouring on the cast. Don't over contour, because it's going to be more work for the dentist or the oral surgeon. Template can be acrylic or vacuum formed or printed. So we've been utilizing the printed. We're making it nice and thin, and it's been working pretty nicely. And so this is important. We try to do a surgical template when we're making, especially when we're doing full immediates, where a lot of teeth are going to be extracted. So just showing a little case sequence here, case before further extractions on the left, after extractions, after extractions, after it's healing, while it's healing, and you can see how the resorption is coming into play here. And look at the case after healing. So now we're going to have a lot of resorption. We're going to have a denture that's going to be loose and moving around. And so this is a case after insertion, but we have to reline the case. So it's, just keep in mind that immediate denture should be a temporary denture. And then we can talk about what's going to be the finalized treatment plan. Okay. And we're also using printed technology for hybrid transitional dentures. So we're actually utilizing a surgical guide for printing these transitional type of printed dentures. Yeah. So when we utilize a surgical guide, we're able to take that technology and the file incorporated into printing a temporary denture with the access holes in the denture already. So we're utilizing this for the printing of the transitional denture with access holes already drilled there for the transitional denture. So if you're doing a chair side conversion, this works out really well. Saves a lot of time when as far as curing in those temporary cylinders chair side. And this is just a couple of photos here. This is a whole other course I do. So it's just little bits and pieces of some of the courses that I do present. And this happens to be the implant course, taken from the implant course I do. Just wanted to show you that information with the printed types of all-on-4, all-on-6 type of dentures. And then we have our jet technology. I don't know if anybody was at the midwinter meeting or if you're going to be in at LMT West in California, but take a look at the Myerson TrueJet S3. Amazing. Then it's also Stratasys it's a good. The denture jet is another technology that's really being utilized out there. Capillaries and opacity and translucency on the gingiva is there. Laid and variable translucency on denture teeth. It looks beautiful. So a lot of things have come a long way, especially with the jet technology that's out there now. So if you get a chance, go online and take a look at what's out there with the newer technology. And it's changing on a regular basis and getting even better. Can we make a better denture? I believe we can. As long as we have the communication and the right tools to make that denture, and we have it and the right materials. So that's just sort of like a little short synopsis on navigating what are the materials for dentures that you should be using, or my suggestions on what to use. And we'll take some questions later on, but I'm going to go into another segment now of this seminar here. So I want to talk a little bit about printed models. And the reason why I talk about this, printed models, especially for implant cases, have been a little bit of a thorn on my side, because when we're printing models and we have our printed models with implants, how many times do you have the abutment moving on the model? You're moving in and out, you're taking the abutment or in and out, and you're trying to push it back in, and you hear kind of a crunchy noise. But sometimes it's not accurate, especially with all on 4 cases, all on 6 cases, all on X. So now there's a new technology. Now you can use your printed, regular printed material, a new technology, a company called IPD, and they have a free software called Model Pro. So now we know that those dies and the implant analogs are going to stay in place on this model, and they're going to be accurate. I'm going to show you a short video here how I do that. So we have our implant model here, and what we're doing here, printing in whatever material of your choice. So these analogs are going to be screwed into not only this print, it comes printed with the access holes on the side and on the bottom of the model. So you can print these, and these are just special parts that you can buy that you can incorporate into the model. And so you have not only on the side, you have security, but on the bottom of the model. So you're securing those analogs and abutments on these implant cases. So it really works out well. So I just wanted to show them you have your soft tissue here. So beautiful, predictable type of experience on these types of cases, whether it be 1, 2 units or a full arch type of case with implants. So let's move on to the next topic here. So I know we have a lot to cover today. I told you I try to squeeze everything. Let's talk about partial denture technology, and then finally we'll talk about bite splints. So partial denture technology, we still do a lot of partials in our laboratory. And as I go around the country, many labs are the same way. There's a lot of RPDs out there, and it has to be done the right way. But this article in the Journal of Prosthodontic Dentistry stated that the number of partially dentate adults is increasing, and many patients will require replacement of these missing teeth, or RPDs. Significant need exists to advance materials and fabrication. So this is one in the Journal of Prosthodontic Dentistry. So Design, materials, ease of repair, and patient education and follow-up for RPD treatment all has significant impact on treatment success. But listen to this. Almost 40% of patients no longer use their RPDs within 5 years because of factors such as pain and aesthetics. But now we can make a predictable RPD. I use sinter technology with RPD fabrication, but also the case planning on RPD is very important too. Not only full dentures, immediate dentures, but RPDs also. Examination of the patient, examination of oral structures, complete radiographic surveys, mounted diagnostic casts. We do this for every RPD. Survey that diagnostic cast, and then we can design and record those mouth preparations and work together with the doctor. And we're getting some really accurate scans on RPD cases. RPD cases and immediate dentures we're having a lot of success with. I don't have time to get into the workflow too much with full dentures today, but most of the full denture cases we're doing with digital technology, the doctor is taking a wash impression and then scanning that wash impression and bite. So back to partial denture planning. This is a great book. I talked to a lot of our doctors and it's called a clinician's guide on removable partial dentures. And it gives you a lot of the basics with major connectors, minor connectors, what kind of clasp design to utilize. And it's a great book to have chairside and in the laboratory. So it just talks about survey, support, rest seats, reciprocation, connectors, indirect retention, and saddle areas too. And when you talk about digital technology, all that has to be considered also when you're designing a case. I mentioned earlier, I love designing partials on digital partials with either Exocad or 3Shape. And at first it used to take me about 20 to 30 minutes, and now I can do it in about 10 minutes. So the more you do it, the more proficient you'll get at it. So look how many partial steps there is to making a traditional partial. I'm going to go through this quickly. You have a refractory mirror, you're going to invest it. Number 11 steps is 12 steps, cleaning it out, sandblasting, finishing, polishing, fitting, 21 steps. It's a lot of steps in making a partial, a lot of time. So we looked at the average survey design and duplication, waxing up, investing in burnout a case. And don't get me wrong, I'm not taking anything away from traditional metal framework process. I have hats off and kudos to partial denture technicians around the country because they have a tough job. It's a tough job especially when you're doing this analog and doing it the correct way. So I counted 7 hours and 15 minutes total. This is like from start to finish, waiting time, setup time, and making a partial denture, so, and then you have to fit, finish, and polish. So with the new design modules for 3Shape and Exocad, and with laser sintering, we can do up to 30 frames in an 8-hour period. So it's pretty cool. So with this laser sintering, and actually there's excellent fit. So we're doing supports with implant cases, partial dentures. I'm doing obturated cases now with these types of frameworks. A lot of stuff that's involved, with making these different case scenarios, but pretty much successful and predictable. And we've had a lot of great success with sintering, laser sintering partials. This is another, my RPD, a clear perspective on RPDs is about a 3-hour course. I also give that course also, if you want to check that out online. But it's a great course with a lot of information on designing and producing partial dentures. I talked earlier about printing temporaries. So printing temporaries, you can utilize the same material you're using for printed denture teeth for these temporaries. Design is really easy. This is Exocad, designing with Exocad. Once it's printed, just touch it up a little bit, and you can, maybe you have to adjust the bite, but just finish and polish. And I come over with a glaze. Sometimes I use mostly optic glaze with glazing these types of temporary crowns. So, and people ask me, what do you do for your temporaries? So you can utilize that same material that I talked about earlier for denture teeth. It works out really well. Okay, so this is the final segment here. Let me see how we're doing with time. Okay, good. By the time I get through this, we should be through. We should pull the whole seminar, and hopefully we can have some time for questions and answers. So I just did this occlusal splint seminar, which is usually a 2 to 3 hour seminar. I have a 2-hour seminar online. I did it was a webinar, and I had at one point 800 doctors sign on to this occlusal splint seminar. And this is probably to this day, besides my implant seminar, one of the most popular seminars in occlusal splints. And why? Because I've been around the country watching people design occlusal splints, and many times they don't know the science behind what they're doing. And I try to get that across. And it's not just drawing a line around your natural dentition and printing a bite splint. It's a lot more to it. So occlusal splint therapy may be defined as the art and science of establishing neuromuscular harmony in the masticatory system by creating a mechanical disadvantage where parafunctional forces for removal appliances. And that's a lot of words right there. And everything comes into play when you're planning these cases. A properly constructed splint facilitates a mutual protective occlusion. So what is occlusal splint therapy? What type of splints are available? How do splints work? And which type of splints should be used and when? So we're going to do a little summary of this. We don't have time to get into everything today, but we'll talk about some of the aspects, the key aspects of fabricating occlusal splints. So occlusal splint therapy 101. What are the terms you hear out there? Mouth guard, bite plates, splints, hard splints, soft splints, combination hard, soft, full arch coverage of several teeth for TMJ disorder or protection of natural dentition on newly restored cases. So there's a lot of choices out there and it can get kind of confusing. So there's stabilization splints that prevent teeth from grinding and clenching. Splint coverage is on all of the teeth and typically just worn at night. And that's pretty much what I wear at night. Repositioning splints, which are designed to correct occlusion. And that's typically worn all day, every day. And how does splint therapy resolve issues? Splints allow ligaments and muscles to relax, prevents that jaw reaction such as grinding and clenching, eliminates the pain and discomfort with TMJ disorder, and helps bring occlusion into a more optimal position if the patient needs some occlusal adjustment. And it offsets the negative effects of bruxism, grinding teeth at night, or grinding teeth during the day. I find myself grinding during the day also. Not that dental technology is a stressful job, but I do grind a lot. So, and a lot of people do that during the day. So some of the signs and symptoms of unhealthy occlusion: wear, fracture, and chipping of teeth, sensitive crevices on teeth and gums, gum and bone recession, loosening or shifting teeth, worsening of periodontal disease, damage to dental bridges and implants, tender muscles, headaches, and noises when you open and close your jaw. You might hear people when they open and close the jaw, the popping noise. That's normal with TMJ disorder. So we want to make a splint that's going to be able to acclimate to a patient's occlusal forces, which can equal up to 500 pounds per square inch. Isn't that something? So it's again, the symptoms. These are symptoms of TMJ disorder. A lot of different symptoms out there. You might have them. A lot of people do. And in the dental laboratory, not only do we want to negate these symptoms, but also for the dental laboratory, it's just going to be a real big profit center in making printed occlusal splints. So what are the concerns? Type of appliance, type of design, the length of treatment, expected results, patient acceptance, decreased pain, increased TMJ range of motion, and better occlusal efficiency. And of course, ongoing increased improvement with your TMJ and occlusion. And of course, we want to have a splint design with quality material. The expected results: protected TMJ from dysfunctional forces, and stop the possibility of perforations or displacement in the ligaments and TMJ joints. So we want to create that stable and balanced occlusion. And sometimes it's hard to do that. And one quick story: my wife had that popping sound, and she couldn't bring her occlusion into normal occlusion until she got a correct occlusion splint made. And now she's biting normally. We want to create that harmonious relationship with all muscles, discs, ligaments, and bones. So this is an article by Leonard Hess from the Dawson Academy. I use a lot of the Dawson principles when I'm designing bite splints. And every patient should have oral and medical dental history looked at and evaluated. Evaluate the range of motion on these patients. Do a centric relation to load test on these patients. A lot of times all we do is get a quick impression from a doctor, and his doctor says, make an occlusal splint on an upper. We need more information than that for the success of the patient. If we don't get that correct information, sometimes it could be more detrimental to the patient. Evaluation of dentition wear, a CBCT or MRI if necessary. Dr. Hess swears by doing this on every case, and I agree with him. So let's talk about the digital technology with bite splints. So I was so happy when we got into digital technology and printing with occlusal splints and bite splints, and it makes life a lot easier. And some of the advantages of digital versus traditional in a dental office is there's no impression necessary, no impression material necessary, rather. By registration can be scanned, no gypsum needed, reduced material and labor costs, and reduced chair time. And the CAD technology is so easy. It's so easy to scan a full arch, get a bite, send it to us at the laboratory. The file is always available if the case is lost or broken, just like with the digital denture. And there are various printed material choices now. There's soft splints, hard splints, and there's a lot of options out there to choose from. And in the dental laboratory, again, time savings, no models to pour. We have a virtual articulation. We don't have to articulate the case. It's a quick design, really, to print. And printing time is less than acrylic curing time. No gypsum, no wax, no duplicating, no acrylic. And that consistency and accuracy of the design is right there. What you see on the screen is what you get when you print that digital splint. And we can design these with cuspal exclusion or anterior ramps. This is what we try to look at, as far as when we do our designs, what is going to be the best kind of solution for the patient. Is it going to be just a flat plane occlusion, or we're going to put a disclusion, cuspal exclusion, or anterior ramps? So real quick, let's look at the time comparison here with a traditional printed bite splint, four model and duplicate. By the time you wait for everything to set, and it's about an hour and 45 minutes. And then we'll have our wax, flask, pack, cure, whatever. Even if you're pouring the occlusal splint, total time was about 5 hours and 15 minutes, which is a lot of time. And now when we look at digital technology, we design, nest and print. That's about 55 minutes. And then we'll look at the final. We clean, post-cure, finish, and polish, about 25 minutes. Total time is about 80 minutes. But the good thing is you can do a number of these at one time with different designs. So that's what I like about digital technology and printed technology with occlusal splits. Designing is great. We have the virtual articulator. There's a number of different options for 3Shape and Exocad. And you can make a flat plane, anterior ramps, cuspal exclusion, upper or lower, or both. This is the Exocad design. The thickness, you can look at blockout strategies, to make sure you block it out correctly. The thickness, there's a lot involved when designing this, but it's pretty easy. Everything's at your fingertips. And after you do a few of these, the more you do, the more proficient you'll get at it. And there's a virtual articulator in Exocad. Fully adjustable, which is great, when you're doing these types of appliances. Cuspal exclusion. This is what I have on my occlusal splint. And when we're printing these, there's a number of materials that are out there. Really, key splints is my choice. Also, Desktop Health has great material also. But key splints is fully biocompatible, transparent, it's polishable, it's stain resistant. I just had one come in today. We just had to do a little occlusal adjustments, we printed this a little earlier, and it's so easy to grind and polish, and it's really, with the carbide bar, really works well. And we're utilizing the key splint hard now, also with different, but a hard soft type of material, and it works out really well. So real quick, what I do with my hard soft material, I'm actually doing key splint hard. And I'm creating a little bit of space on the occlusal areas. And I apply a VersaCurl material inside, and I put it back on the model, on the printed model, if I have it, and I put it in the pressure pot for about 10 minutes, and I have a hard, soft night guard. But that's my method of doing it. Patients love it. And that's a combination of VersaCurl and key splint hard. But design is great. It's easy to do, but it's not just, going around and making your borders and then creating your thickness. Keep in mind what's going to be the best type of appliance for that patient. And this is that key print soft material. As you can see, it's pretty pliable. This is a simple design here. This is provided to me by Keystone. But what's great about this key splint material, you could just twist it around. It goes back to its original shape. Real nice material. So we come a long way with production and materials, with many different aspects and appliances in the industry. But with these materials, just make sure that you keep in mind, don't lose focus on patient acceptance. So we want the perfect blend of strength and comfort. We have flexural strength for durability, sure hardness for flexural strength, modulus, and shape. And all these things come into play with the science of this material and the biocompatibility for patient safety. With that, I think that's all the time I have today. 2:57 here. I'll try to take some questions, but just keep in mind, all of this comes into play with keeping in mind patient satisfaction. I want to thank everybody for attending today. I could probably go on for another 2 hours and go more in depth with this, but at least gives you some idea of what's direction to go in, possibly to when you're choosing these materials. But thank you, everybody. Whatever questions you have, I'll be glad to take if we have a few minutes.
Thanks, Dennis. We do have a couple of questions. The first one is, what advice would you give to me if I'm not 3D printing at all? Have I missed the boat?
Oh, no. I mean, I would say, you have a lot of options with 3D printing too, even with outsourcing in the United States here, and even design centers. If you're not used to 3D printing or designing, you can get someone to design it for you. And there's different laboratories and different laboratories around the country that will print these for you. But just keep in mind that it is happening here. It's been pretty much every doctor that we talk to now, and I go to visit, even at dental shows, is asking about 3D printing technology. So I wouldn't say you're missing the boat, but I would say the act of doing nothing sometimes is failure. And I would say just learn all you can. What's going to be best for your business and for your different scenario in the laboratory.
And there's another one. I am just printing models. How can I get started printing other offerings?
Yeah. So if you want to get started printing other offerings, I don't know if you have to, if you're going to be designing, but if you want, I mean, you can get these designed at other locations for you, for designing bite splints or dentures, and then you can get the correct modules or the correct printer in your laboratory to do that. So it's really not that difficult to get started. And then eventually, maybe you'll start designing in-house. Get the modules you'll need, the design modules you'll need on 3Shape and Exocad, and then start designing in your house and get the training you need. These companies have a lot of training programs for you too to learn. There's a lot online too. On YouTube, there's a lot of training out there. And I know Exocad and 3Shape have some great training programs, as does Zahn Dental. Zahn Academy has a lot of training programs on this also. Yeah.
Sure. So William wants to know, what's a good resin for immediate dentures? He said some of them are pretty expensive resins for a immediate price point.
Oh, as far as immediate dentures, I'm utilizing most of the time. I'm using the Dentsply resin. I know it could be a little bit pricey, but I talk to our doctors. The price point for a temporary or an immediate denture. Yeah, you want to try to save some money, but keep in mind that I talk to doctors and I say, this is one of the first experiences for the patient. I said we want to provide a good material for them. Patient might have this for a while until we go to completion. But either Flexera, either one of those three that I mentioned before are all good options. For immediate dentures. If you're not used to, just do the science behind. Look at the properties of these. Want something that's going to have great bonding strength, bonding capabilities, and fit and function. You don't want to make an immediate denture for a patient for the first time and start having teeth pop out of them. So I would spend a little extra money. Sometimes it's worth it. Most of the time it is worth it. And we'll talk to our doctors and get that message across. Because how price conscious a lot of doctors could be. But as a laboratory, we have to run this like a business also. But also we have to look at the longevity of the appliance and the benefit for the patient.
And William wants to tell you thank you for that. Thank you.
Okay, you're welcome. Thank you.
I want to let everybody know what's happening next on Zahn Academy. So next week, we have digital workflows and taking a deep dive into an integrated solution from design to milling, featuring Hyperdent and XT Sera, mills. Okay, and that's going to be with Milos Markovic, CDT. And our road shows are coming to a city near you. So here we're going to be in Nashville on April 19th, and on May 3rd, we'll be in Salt Lake City. We also have a 3-shape denture design course in Salt Lake City on May 2nd, and there is only one spot left for that. And we're only taking 10 designers because we want it to be so one-on-one so that you get like a really good instruction. These road shows are going to be everything about 3D printing, so we'd love for you to join us. Just take a look at Zahn Academy for the instructions on how to sign up. And I just want to let everybody know that we have a lot of new innovations with Zahn. And one of them is a polishing machine. And that allows you to polish all types of restorations and appliances at one time, saving you so much time. And it's called the auto finish. So take a look at our YouTube channel to be able to see that. We have a couple of different webinars on that. So we'd love for you to take a look at that, as well as a new software called Nemotech. And that was last week. That's also up on YouTube. So if you're thinking about offering, orthodontic guided implants and bone reduction type of appliances, this is all on treatment planning, and we'd love for you to take a look at that and join us if you're interested in May, the end of May, the 29th and the 30th. We are going to be having a course on that at our Wakefield, Massachusetts Technology Center. You can call your Zahn representative or email us at zahndental@henryschein.com, and we'd love to give you some more information on that as well. Dennis, I'd like to thank you so much for joining us today. You gave us a lot of great information.
Thanks thank you, Fran, and thank you to Zahn and Erica and everybody at Zahn, at Zahn Dental, and some exciting technology out there. It really is. So I'm looking forward to it. So have a great day, everybody. Thanks for joining us. Appreciate it.
Thank you so much. Have a good day, everybody.
Take care. Bye-bye.